Hello, my name is Dr. Andrew Christensen. I'm a research professor of psychology at the University of California, Los Angeles.
And I'm Dr. Brian D, professor of psychology at the University of Miami. So Andy, I was hoping you could get us started by talking a little bit about why you decided to write an updated version of the IBCT manual.
Sure, the original version came out almost 25 years ago. And so a lot's happened to IBCT in those almost 25 years. There's a lot of additional research. When we published the manual, we were just doing our pilot trial. But this is not a research book. This is a clinical book. And a lot of things have happened that have sharpened our clinical focus and helped us put into more detail the clinical procedures of IBCT. There are two major developments. One is we've been training therapists in the VA for the last 10 years, and so had to develop training protocols. And also, as you well know, there's an online program based on IBCT that you've led that involved getting into the nuts and bolts of how to portray these IBCT principles to couples.
Yep, yeah, and we're definitely going to talk about that a little bit later. So then other than the new material, what else is different in the book?
Well, we do a comparison of IBCT with the other evidence-based treatments for couples so people can see similarities and differences.
Yeah, I think the other thing that I really like is how the updated version presents a couple at the beginning of the book and then returns to that same couple to kind of illustrate the new points as they come up. I found that really kind of integrated it very nicely.
Right. And because of the efforts, both the VA effort that I've led and the online effort that you've led, we've been able to provide more detail on how you implement the various treatment procedures of IBCT. And so I think there's just a lot more, without becoming a cookbook, the manual presents more steps and guidelines for implementing the treatment procedure.
Right. And I think more than half the manual is completely new or substantially revised, right?
Absolutely. So there's something old in it, and there's definitely something new in it, as they say about weddings.
Yep. Yeah, so I think therapists already familiar with IBCT will kind of recognize the core structure of assessment and feedback, intervention, and termination. And of course, the core strategies of empathic joining, unified detachment, tolerance building, all of that, those are still in there. I think they're just expanded on or presented in ways that are hopefully, should be more accessible.
Absolutely.
So actually, so speaking of accessibility, one of the big things, Andy, you and I have been working on in the last few years is making IBCT more accessible to couples. And Andy, a big part of that's been training therapists within the VA system. Do you want to talk a little bit more about that?
Sure. And I would, it's been, as I said, a 10-year effort where we've been training therapists in IBCT in the VA and using, and we'll now be using this updated manual. We were using the older manual, but we will be using this updated manual. And for people who are interested in a description of IBCT, particularly as it's adapted for veteran populations, but a good description just in general, should go to the website Treatment Works for Vets. And if they go there and access the link on relationship distress, they will see a description of IBCT plus some short, good animated videos about a couple going through IBCT. So it really provides some detail there.
Yeah, those are great videos. I also have a video describing how our online adaptation of IBCT, the OurRelationship program, can be integrated into an abbreviated course of IBCT. So as we described in the updated therapist manual, the integration can really be a great model for therapists just getting started with IBCT, as well as to reach couples who are unable to attend a full course of IBCT, either because of cost or insurance or logistical constraints.
Okay, so anyway, we hope people will read this treatment manual and get some benefit from exposure to a very strongly based evidence treatment for couples, integrative behavioral couple therapy.
All right, well, sounds great. Thank you very much, Andy.
Bye-bye.